Well, thank you for the introduction, Yadiel, and for the opportunity to be with you all today to have this really, really important conversation around self-care, and particularly through the lens of stress reduction as we think about our mental and emotional health and wellness. So not only for ourselves, but for our clients as well. So that's sort of the thread, the theme, if you will, throughout our time today, which is to talk about definitely things that you can do for your own self-care, but in also work with other people in your lives, whether it is through your work or even through your personal life. So I'm going to go ahead and get started and to say that this is a CME approved activity and workshop. So myself nor any of the presenters or planners have any financial relationships to disclose. And during our time together, we are going to talk about the importance of self-care and specifically around burnout prevention. So how we take care of ourselves to avoid burnout and the importance of that. And then I'm going to go through a lot of different self-care and stress management techniques. And so to be able to walk away with at least one of those would be ideal. And again, to assist yourself as well as your clients. Agenda is to talk about the importance of self-care now and sort of why is the current times calling us to take care of ourselves in a different way, particularly around stress and stress reduction. Go through a lot of different self-care practices and then stress reduction tools and strategies, and then maybe talk about a process for a daily check-in. And then hopefully have some time at the end for some questions, Q&A, question and answer. With that in mind, I also encourage you during the course of our time, if you have questions that come up through the material, go ahead and put those in the chat function and we'll try to monitor those and or get to those at the end as well. This is also meant to be an interactive and experiential workshop. So I invite you to participate where it feels comfortable, because as you're learning these tools, these are things that if you practice them, then these are things that you can carry with you in your own daily life and with other people. Okay. All right, so let's go ahead and get started and talk about why self-care now, right? So in my mind, self-care is something that should always be at the front and center of everything that we do. And in fact, a lot of trainings that either I've been to and even have facilitated in the past, we sort of give you the information and then at the very end we say, oh yeah, take care of yourselves. So I want to just sort of flip that around and say that really we got to start with self-care first. And why is that kind of showing up so prominently right now? So this is an image that kind of speaks to where we are right now with the public health, healthcare status, the status of our pandemic. And this is an image that came out during our shelter in place that talks about the 4 waves of our pandemic of coronavirus and COVID-19. And as you notice, most of the waves go up and then they go down. And so our first wave was more about kind of this immediate mortality and morbidity. And then we were focused on like resources, what's available, what's not available, knowing that, we didn't even have enough resources, PPE, hospital beds, that sort of thing. Then we sort of focused on types of populations that are being impacted. Elderly, vulnerable populations, marginalized, racial and ethnic populations, and how this is interrupting a lot of care. In our 4th wave, which is the wave that I kind of want to point you to, is the red wave that's sort of going all the way across and steadily increasing, is the wave around the psychological distress, trauma, mental health, mental illness, the economic impacts and burden, and of course, burnout. And so burnout is true for not only our healthcare professionals and our frontline workers, but for all of us that are patient consumer facing, for the people in our lives, for the change that has abruptly happened, and the new, right? I dare even say the new norm, because I don't even know what the new norm is yet, and or the uncertainty of where we are going with this. So all of the impact around that, and even now we're seeing, of course, there's a new wave, if you will, around more cases that are showing up around COVID-19. But this red line, which relates to the emotional distress, is the line that continues to increase over time. So with that in mind, it's so, so important to be putting our self-care front and center, particularly for the trauma, the traumatic impact, and the burnout that exists with the current situation. So important to say that self-care is client care. We have to take care of ourselves first in order to be there effectively to take care of others. It's sort of like that analogy of being in an airplane, and when the air mask comes down, right? You must put your mask on first before you're able to help others, right? So that's the theme that I really want to share with you and emphasize, is that stress and trauma can be very, very disorganizing and disabling. And the effect of that is burnout, vicarious trauma, even compassion fatigue. And those things are real and true, especially now. If you're not already feeling it, it's likely to happen. And so we need self-care at all times. But loving care is also a contagious thing, which means that when we take care of ourselves and model that, it affects how other people feel and take care of themselves. So to do self-care is also to do other care or client care. So let's talk a little bit about the nature of stress. This is not necessarily to go too much into the physiology per se, but to say that stress is like a watering can. And if we think of our bodies and our systems as a plant or a tree, and if we're constantly watering the roots of our tree with stress, it's impacting the root level of who we are. And so what happens is that there's a hormone that gets released. It's called cortisol. Cortisol is the very, very important hormone that we all need for functioning. But in overdrive, cortisol can actually have a negative impact, and it relates to things like inflammation, infectious disease, chronic diseases, and has an impact on our nervous system. As a result of that, people start to experience psychological distress and emotional distress, and then pain, again, physical or emotional pain. And then the common reaction to that is to self-medicate or to go through to unhealthy coping mechanisms, right? And I'm sure that we can all speak to the different ways that we have seen coping happen during this space and time. Whether that is, eating more sugars and carbs, or having alcohol, tobacco. I've also heard that they're showing trends that during this time, opiates are on the rise again. The use of opiates, pain medications, is on the rise. So a lot of the effects of stress in our lives are impacting, and people are leading people to unhealthy coping. So the goal of stress reduction and self-care is to calm down the nervous system, and particularly the parasympathetic nervous system. So we have two sides of our nervous system. We have the autonomic nervous system and the parasympathetic. The parasympathetic side of our nervous system actually wants to be in a state of calm. It wants to be in a state of rest. And when it is, it slows down the release of that cortisol hormone, which eventually leads to all of those after effects that we saw in the last slide. And within the parasympathetic nervous system, we're focused on the vagus nerve. So you can see an image here in the bottom right-hand corner of the vagus nerve. The vagus nerve is kind of like a tree in our bodies, right? It goes from our brain through our neck, torso, into our abdomen area, and has all of these branches that go out to various parts of our bodies and keep a lot of functions in check. And so I like to call it a symphony conductor because it really directs how your nervous system reacts in response to external events, environment, and stress. And so as we talk about a lot of the different techniques, the evidence behind the effect on the parasympathetic nervous system and the vagus nerve is strong. And so to keep that in mind is that's kind of the goal that we're looking for, is to calm down this part of our body, which eventually calms down the rest of our system. Okay. So among the core values of self-care are things that you see on our left-hand side here. And again, all of these things are in relationship to how we calm the nervous system. Sleep, resilience, the environment around us, getting movement, the types of relationships we have, spirituality beyond, this is not just necessarily religion, but any type of focus on one's inner self, nutrition and eating well. And although I may not have time to go through all of these during our time today, we're going to touch on a good number of them. And I like to also encapsulate them into 4 areas of types of self-care: physical, emotional and mental, social, and spiritual self-care. And so that will be kind of the thread, another sort of thread that we'll have through our time, is how each of the types of techniques and tools fits in one or more of these categories. All right, so with that, I will dive into our self-care practices. And again, if you have any questions or comments, feel free to use the chat function along the way. All right, so the first self-care practice that I want to talk about is related to what we've just been talking about, right? Which is around the calming of the nervous system and the vagus nerve. And so the way that we connect to ourself is through breath, rest, and calm. And when we build in the appropriate breath, grounding, stabilization, it spreads out to other parts of our body. And so there's a very easy, accessible technique that's called the 4-1-5 breathing technique. This is a technique that is actually being used and taught to frontline workers, healthcare professionals, firefighters, even children in schools have been taught this technique. It's also easy to remember because 415 is a local area code, right? It's our San Francisco area code. And the technique is very simply to breathe in for 4 counts, hold for a count, and then breathe out for 5 counts. And as you're doing this, the idea is to expand your belly. So bring breath into your belly and your abdomen, sort of like a balloon, right? You're expanding the balloon and then contracting the balloon, or like an accordion, expanding and bringing it back. And why are we doing that? Well, it's because the vagus nerve, again, as I said, is coming from our head down into our abdomen. And when we breathe into that area, we're sending breath, calm, rest into all of the parts of our body. And we breathe out for longer because that's the side that activates the parasympathetic nervous system side. Now, again, there are many types of breathing techniques, so this is just one of them, but this is one that has been used a lot and is based in evidence as being really helpful and accessible. So with that in mind, this is our first experiential activity, which is that I invite you, wherever you are, no matter what you're doing, just to take a moment and to sit back, whether you're sitting down or standing or wherever you are, and try out this technique. And I'll talk us through it. So just sort of sit back, maybe opening up your shoulders a little bit, hands at your sides or in your laps. If it feels comfortable to you, you might close your eyes and start to breathe. And we're going to breathe in for 4 counts and holding a count and out for 5. So begin breathing in, 2, 3, 4, and holding, and then out, 2, 3, 4, 5. And in, 2, 3, 4, and out, 2, 3, 4, 5. Again, in, 2, 3, 4, and out, 2, 3, 4, 5. Keep going with that on your own, in and out. And as you take your next breath in, maybe start to bring attention to places where you might have tension. Maybe it's in your jaw, parts of your face. Just notice it. And when you breathe out, letting that go. And continue to breathe in, noticing areas of tension, and letting that go. And as you're breathing in, you're expanding that belly and releasing as you're letting go. And think about letting go as like a waterfall or rain, right? Or washing away the tension, the feeling, the stress. And continuing to breathe in and visualizing letting it go, letting the ground absorb it. Just take it away, let it run off away from you. And go ahead and do one more cycle of breathing in and breathing out. And when it feels comfortable to you, maybe wiggling your toes and your feet, coming back in, opening your eyes, and just noticing. Just notice what feels different now as compared to a couple of minutes ago, or whatever it took this morning to get to this 10 o'clock webinar, right? All the things you had to put in place and the feeling of that as opposed to the feeling now. This is a really, really accessible and easy breathing technique. And it's something that we're going to come back to as we're talking through more of the tools. And I invite you to bring this into your day. It literally took about no more than 2 minutes to walk through this and to take a moment to just stop and bring in that breath, bring in that rest, and bring in that calm. So a really valuable technique that you can use for yourself and to bring into your work with people, with consumers, with also loved ones in your life. Okay, so we're going to move on to our next technique. So speaking of breath, rest, and calm, we're going to now move into sleep, right? So sleep is the epitome of getting that rest, that calm, and good breath, right? And so this is something that all of us need. Every living being needs good, restorative, restful sleep. It's a function of life. And when we don't have good, restorative, restful sleep, it absolutely has an impact on everything. So why do we need good, restful sleep? What are some reasons? What are some benefits of sleep? If you have a moment, I would love to hear some thoughts in the chat function. Just go ahead and type in, what does sleep offer us? What are the benefits of sleep? Give you a moment to just type some things in. Yes, it's a great reset button. Yeah, absolutely. Hi, Alameda. Sustained functioning throughout the day. healing the body, regaining strength, resting the body and the mind. Renewing our minds, emotional detox, lovely. Rejuvenation. Helps with our attitude, absolutely. Great, you got some good ones. So what I'm going to do is I'm going to put up some of the what we know around the research and the evidence base related to sleep and sleep function. So also helps with our dreams and offers us relief. Yes, absolutely. So these are some of the things, they're not all of the things, but some of the research around why sleep is good restorative sleep is so helpful. Obviously reduces stress, right? So that's what we're here to talk about. It helps with mood stabilization and calming. So we heard that also as one of the contributions, that when we get good sleep, it helps with all parts of our moods. And it improves memory and brain function. So what we know is that when we get good sleep, our cognitive abilities, our rationale, our reasoning, all are at better functioning level. Relieves muscle tension and pain. So, you know, for anyone who has overexercised, or, you know, people who experience chronic pain, athletes, they actually say that the most restorative thing they can do is get rest and sleep, because that helps them to, you know, jump up and do the same thing the next day. Energy and more mental alertness. So we can all probably think about a time when we may have not gotten the best sleep possible, and then it has impacted our day with our energy and our ability to be alert. It helps fight infections and reduce inflammation. So this sort of goes back to the cortisol, right? What happens when we sleep is that our cortisol levels also even out. And so it helps us with our ability, not only for our stress response, but to fight off infections and reduce that dreaded inflammation that can lead to so many disease processes. I see a couple more contributions in here, and I just want to acknowledge, yes, sleep also helps with healthy weight management, helps with serving a population and empathy, getting at least 6 hours, helps with mood stabilization and depression and anxiety. Great. And then we also know that it has a relationship to a lot of our body functions, and in particular lowering our blood pressure and good for the heart. So people who suffer from hypertension or other heart related conditions are benefited, of course, by sleep, and the heart relates to so many other functions in our body as well. So again, just sort of from the evidence, what we know around why sleep is so helpful and important. Let's also talk about healthy sleep habits, right? So just this might be a reminder for many of you, because I would guess that a lot of you talk about healthy sleep and restorative sleep with people that you work with, but just as a reminder, and or might be some new information in here. And we're going to do this through a mini quiz, which means that as we go through these questions, I'll put a poll up on the screen. And so for all of us to put in our answers and go through this poll, these quizzes together. All right, so our first question is, what are the best uses of the bed to promote sleep? And so I'm going to open up this poll right now. And so in terms of the sleeping space that is used, what is the best use of that area? Is it working on a computer, reading, getting sleep, a place for sex and intimacy, talking on your phone, video chatting? You can answer one, you can answer more than one. And I'll give a couple more seconds for folks to log in their answers here. Okay. All right, so as we see, the majority of people, obviously, the best use of the bed is to promote sleep, right? And also we're seeing almost sex and intimacy and then reading. So the answer here is C and D, which was to use the bed for sleep and to use the bed for sex and intimacy. So we're trying to sort of like train our bodies in a way, right? To limit activities in bed to only these two things so that our body, our mind, our functioning only associates the sleeping area with these things. I just want to touch on reading, which a lot of people will say, including myself, that reading helps to actually sleep, right? A lot of people will read and that actually helps them to fall asleep. That is definitely true. And also, when we're reading, we're actually stimulating the mind a little bit because we have to process the information that we're reading. So the recommendation in general is to, if reading helps you get tired, for sure do it, but to do it away from the bed and then come into the bed when you're ready. So I have a question, how about calming music or nature sounds? Absolutely. So even meditation and the breathing exercise that we did, for example, these are things that are really helpful to promote sleep. And of course, those are things that you can do when you are laying down and trying to go to sleep. We're going to talk about this in just a second, which is the type of device that you use to listen to music or meditation or nature sounds also has an impact. So let me get to that in just a second and I will address that as well. Let's go to our next question. So if you're not able to fall asleep, what is the recommended time limit to get up and out of bed? So I'm going to launch this poll. So in general, if you're not able to either fall asleep or if you wake up in the middle of the night and you find that you're not falling asleep, what do you think is the recommended time limit that you're supposed to get up and get out of bed and try again? Giving you all a couple more minutes here. Okay. All right, so I'm going to end this polling and you can see we are looking at, for the most part, people answering between 20 and 30 minutes. And that is accurate, which the recommendation is 20 minutes. So that seems like a very short time, especially when I thought about that the first time. 20 minutes can go by quickly. But if the idea is that if you can't fall asleep or if you are waking in the middle of the night and 20 minutes have gone by, it's time to get up out of bed, do something boring or calming until you feel sleepy and then try it again. Actually, the worst thing that we can do is toss and turn in bed and or watch the clock, right? So I'm guilty of that too, where I'm looking at the clock and I'm like, oh, another 40 minutes have gone by, right? Another hour has gone by. That actually can build more anxiety. And so when you're noticing that it's at the 20-minute mark is to kind of, get up, do something boring, calming, and then try it again when you feel sleepy. All right. How much time before bedtime should physical movement be completed to actually get the best sleep? So let me open this poll for you. And you can answer this question here. So in general, what's the recommended time limit to complete all physical activity, movement, strenuous exercise? Okay. I think we got a good majority of folks have answered, and the majority of the answers is 3 hours. And yes, that is true. So the recommended time limit is 3 hours. So what I want to say most importantly is that it's really, really critical that we all build in some physical movement every day, whatever that might look like for you. and because it also helps promote sleep. But the best form of movement is to do it earlier in the day, whether it's the morning or early afternoon. And that we cut off our strenuous activities at least 3 hours before bedtime. So that means that, you know, if you're normally going to sleep at 10, by 7 p.m. or so to end your strenuous activity. Because again, we're trying to train our body into the sense that after 7 p.m., it's time to get into that rest state. All right. Next question. What is the natural hormone that helps to regulate sleep and wake time? So let me launch this poll for you, and then you can go ahead and answer. A hormone that helps to regulate sleep and wake time. Is it cholesterol, cortisol, insulin, melatonin, or serotonin? All right. Looks like we're hearing a little bit of background noise. So if I can kindly ask you to mute your phones or your computers. Thank you. All right. So looks like most of you got this, which is melatonin. So obviously in sleep, I mean, there's a lot of hormones that play a role in terms of our sleep cycles, but the one that's most prominent is melatonin. And just to kind of review that what we're trying to do is train our bodies into this concept of a circadian rhythm, which means that your melatonin stores are to be at their lowest when you wake, and then at their highest at the time of sleep and the time of rest. So one of the tips is that when you wake up, to turn your face towards the light or to expose yourself to light, because then your body starts to naturally produce that melatonin. And this also, the second part, which is to limit screen time, goes to one of the comments, which is the ways that we help ourselves to fall asleep. And just to be aware that, you know, our devices, which we all use, and they're so critical to us, tablets, smartphones, TVs, etc., laptops, they have a light behind them that actually impacts our melatonin stores. And so to try to turn those off at least 1 hour before bedtime is recommended. And so that also plays a role. You know, sometimes I'll, for example, listen to soft music or meditation before bed, and I actually have my iPad, right? But if I'm looking at my iPad while I'm doing it, it's actually not going to help me fall asleep. So to be aware of the time of which you turn off those devices and actually get into sleep. All right. This is our next question. What is the stimulant that affects getting good restorative sleep? Launching this poll now. So think of a stimulant that affects our sleep. Nicotine, tobacco, caffeine, sugar, alcohol. All right. Looks like we got a good majority of people voting. So obviously caffeine, yes, that is coming up on top. And then we see a variety of other ones. So the answer here is all of them, right? All of these are considered stimulants, and in some way, shape, or form, they either impact us from falling asleep or they wake us up because, like for example, nicotine, when our bodies, when nicotine starts to leave the body, it actually wakes up the system. So it can impact your ability to fall asleep, waking up in the middle of the night, or interfering with especially the deep REM sleep, the rapid eye movement sleep, which is the most restorative sleep that's possible. All of these things impact REM sleep. And there is actually a lot of research and evidence around, a lot of research that's going on around the impact and the timing of all of these. A question, is it all carbohydrate sugars or certain types? So white sugar for sure, white sugar, white flour for sure. And in general, other types of sugars can also impact sleep. But it's sort of a range from, like, you know, the processing of the white sugar flour carbs to the more healthier organic forms of sugar, which probably have a less impact, but all forms of sugar to some extent have an impact. And know that for the most part, our bodies, when we eat food, all types of food convert to sugar. So it has, you know, it also relates back to, you know, the sugar index of each type of food and the quality of the food that we're eating. All right, good questions. All right, so a couple other things around sleep is to create a healthy sleep ritual, right? So whatever that means for you, whatever you can bring in that works for you around bringing yourself and training your body into a good place of sleep. And then also in creating an environment for sleep. So we saw that one of the tenets of self-care was environment, right? The physical environment around us. So a lot of different ways that we can help support the best sleep possible through lights, reducing electronics, possibly making the room cooler, whatever might work for you. And so to think for yourself of the many ways that you can sort of play with different things that might help you to get the best sleep. All right, another question coming up. How about a cup of decaf green tea? Yeah, so decaf in general is better for you than caffeine for sure. You know, though I don't have a whole lot of time to go into nutrition and supplements, green tea is one of the best sources of calm, rest, helping manage and balance our hormone and cortisol levels. I will say that most things that say that they're decaf still have a little bit of caffeine in them. So just to be aware that that might be an issue. And for all people, I would say there's individuality. So to test out for yourself how much of decaf green tea is, you know, impacting you. Maybe it's reducing it to half a cup or a quarter of a cup, just to sort of get the feeling and the taste. So again, good questions coming up. All right. So that was our section on sleep and getting good restorative sleep. And now I want to go into another area, which again, with building in that thread, that theme around breath, rest, and calm. And this is a body technique that we can do that's very accessible and easy, and it's acupressure. So acupressure is something that is, like I said, very accessible, something that you can do at any time, do multiple times a day. And it's basically a form of gentle massage. And the beauty of acupressure is that it allows your body to process and release toxins and open up flow, because the concept behind acupressure and other forms of self-massage is that in our bodies, when we feel chronically stressed or tense, our bodies tend to contract. Our muscle fibers, the areas around them, the organs get impacted, and it creates blockages in these areas that we call meridians. So what we're trying to do is turn on our body's own self-healing, stimulating these points to open up the flow so that there is less pain, discomfort, illness, et cetera, et cetera. And you can play with the level that works for you in terms of the pressure that you use for acupressure. And it's something that you can do on yourself as well as for other people. So if you have loved ones around, or even teaching clients through video therapy, whatever that might look like, really, really great self-care technique. So what I'm going to do is I'm going to take us through 4 different acupressure points. And here's another opportunity for you to experiment. and to try these out on yourself, because as you try it on, these are things that you can take away and do for yourself later on. I've chosen these points because they're not only helpful for stress reduction and a lot of the emotional impact of what people may feel and hold in their bodies, but also they have a relationship to opening up our respiratory areas. And for people who experience respiratory distress. So also thinking about COVID-19 and the times that we're in and prevention to open up our respiratory breathing passages as well. So let's go through these. So our first acupressure point is called letting go. Very appropriately named because this point is about relieving repressed worry, emotions, sadness, and it also helps with the breathing, the congestion, coughing, asthma, etc. So you see an image here on your slide, and I'm also, if you can see me in your video, I'm also going to press these points as well. So where this is it's just up from your armpits and like about a notch inwards, and you're going to find kind of the soft area in between your muscles and your tendons there. And the goal with acupressure is that you don't have to be exact, right? Even if you're in the area, it's totally fine. So what you do is you take one or two fingers and you gently massage this point in a circular motion, pressing to the comfort level that's best for you, holding it for 30 seconds, and then releasing. And then going back to that point and pressing and moving it in a circular motion. Like I said, you can do this as many times as you want during the day. The recommendation is 3 to 5 minutes, but honestly, even if you do this for a couple minutes, you're getting the beneficial effects. Again, something that you can do at any time, anywhere. So that's our first point, letting go. Our second point is on our hands. And I bring this point because this is a fabulous point for all of the after effects that accompany stress, fatigue, restlessness, burnout. And where this is on your hands, just below the tip of your middle finger and in between your middle finger and your first finger. And what you do is you take your thumb and just press in that area. Again, you don't have to be in the exact point, but as you're moving in a circular motion, you're stimulating that whole area. And you're pressing there gently for about 30 seconds, releasing and repeating again for a couple minutes at a time. If you feel any soreness in any of these areas, that's actually a good thing because that's telling you where you might need some extra love and attention. Also remember that we are bilateral human beings, so when we do one side, to also do the other side. So this can work on both your left and your right side. So that's labor palace, appropriately named too, because labor is about overwork and overstress and overburden. So this is a good place to release a lot of that, a lot of the burnout and restlessness that comes with overwork. Our next point is on our foot, and on our feet, there's virtually a connection to every part of our body. I think our feet are the most under-recognized and underutilized parts of our bodies that don't always get a lot of attention. But we have a lot of points on our body, and on our feet, that relate and connect to organ systems and functioning in our body. So this one's on the top of your foot, and I won't be able to show you my foot, but you can see in the picture here, this is located between the big toe and the middle toe. And there's sort of a depression in that area that you might be able to feel. It's where the connective tissue is. And you gently massage this area in a circular motion with your thumb. And the great thing about this point is it's also the liver point, which in our bodies, our liver is where a lot of toxins are stored. And so this point is helpful for releasing toxins from our body. So after you do a circular motion for 30 seconds, you then brush your thumb forward towards your toes as if you're expelling toxins out of your body. And then you repeat that a couple times. So circular motion and then sweeping forward, releasing toxins from the body, especially in relation to the functioning of the liver. And our last point is on the bottom of our foot. This is called gushing spring. And so this is for a lot of the different things that also accompany stress. Lack of sleep, feeling dry mouth, headaches, fatigue, over worry, even digestive issues. This is the kidney point on your foot. And this is in the depression that's right between your big toe and your middle toe, just under the ball of your foot. Again, firmly applying pressure to this area in a circular motion with your thumb, and then letting it go and repeating. You can also stimulate this area just by rubbing the bottom of your foot up and down. So again, related to our kidneys, which in traditional medicine, our kidneys are a source. Our kidneys and our spleen and our liver are actually the source for a lot of the issues that occur, a lot of the chronic health conditions and emotional conditions that occur. So 4 acupressure points that are very accessible and very useful at current times. So I'm going to take us a step further and do another experiential technique with you, which is a really, really valuable technique that is for releasing emotions. So we're talking a lot about, stress reduction and self-care for mental health and emotional health. And so this is a technique that's specific to the release of emotions. This is called Emotional Freedom Technique, or EFT, and also known as tapping. So very similar to the acupressure that we just talked about, which is we're focusing on meridians, we're trying to open up energy. Whenever there is disruption in EFT, the philosophy is that the negative emotions that we're holding have a relationship to physical pain and the way that things show up physically in our body. So this is psychosomatic approach to healing, and is a combination of traditional medicine as well as modern psychology. Beneficial for a whole host of things. I couldn't even list all of the things that we know this is helpful for. And there's a lot of different points, tapping points. But we're going to focus on a basic technique that is an 8-point tapping sequence. And this is towards for the upper part of your body. Again, there are a lot of tapping points in your body, but we're going to focus on the ones that are the upper parts of our body, which again, every point that we're stimulating has a connection or a relationship to some organ functioning in our body. Remember that as you're doing all of these techniques, we're still talking about breath. We're still talking about the importance of breathing. So as you're tapping, as it was with acupressure, you're breathing through each of these techniques. So the sequence here, you see the image on the slide, but the sequence starts at the eyebrow and works its way down, and then you come back towards the top of the head. In some EFT traditions, they also encourage you that, for example, if you're having a difficult time, distress in any way, that you bring in a positive affirmation. So I put some affirmations here in the upper right-hand corner, right? Let's say you're having a really stressful day and you're having trouble concentrating and you just, can't get a report done. Well, you might say to yourself as you're tapping, I've got this, I can do anything. I deeply and completely accept myself no matter where I am right now. So I invite you to bring in an affirmation if it works for you. And you're going to tap each of these points about 8 times. You can do more than 8 times, but at a minimum at eight times. So let's try this. So again, if it feels comfortable to you, and remember your breathing as you're going through these points. So you start at your eyebrow and start tapping that point. And then we're going to move to the side of the eye. And you can follow along on the image as well to see these points. And then we're going to go under the eye, so kind of in the upper sinus area, if you will, upper cheekbones. Then we're going to go to the chin. And then we're going to go to the collarbone, which is just below your kind of the bone itself. This is an important kidney point. And then your next spot is under your arms. So it's sort of like under your armpits on the side of your arms, right next to the breasts area. And you're tapping that. And then we're coming back up to the top of our head and tapping the top of our head. All right, so let's go through that sequence again. So we're starting out at the eyebrows, sort of the inner part of your eyebrows where your nose bridge ends. Then we're moving to the side of the eye and the temple area. Then we're doing it under the eye, under the nose. Sorry, I think I missed that in our last point. So under the nose is a point that I missed. So we're doing that next. And then to the chin. And then to the collarbone. And then to the spleen, which is under your arm. And then to the top of your head. And you can do this another cycle if you like, as I'm talking through. So again, at the eyebrow, side of the eye, under the nose, under the chin, at the collarbone, under the arm, and ending with the top of your head. This sometimes for me, like I feel like I'm like a gorilla when I do these different things as I'm moving through my body area, especially the spleen, which is under your arms. But that's okay because these are areas, again, as I said, are connected to many of the organs and functionings of our body. So just by stimulating these, we're opening up these points. You might also see in this image on the slide that there's another point that happens to be on your hand that's on the side of your pinky, just between your pinky and your wrist area. That's called the karate chop, and you can sort of press that area. That's an area that opens up basically a lot of flow, but this is the meridian that connects to our intestines. And so, as I said, with the beginning of our talk around the parasympathetic nervous system and the vagus nerve, this is a really, really helpful place for when you have worry, when you have anxiety, in the moment even. I remember when I was in clinic and we were moving to a new electronic health record system, Epic, and everyone was freaking out. This was a technique that everyone was walking around sort of doing because it was immediately relieving around anxiety and tension. So another really accessible tapping point. All right. So now that we've gone through some body-related things that we can do, we're going to talk about environment a little bit. So there's a whole science around how we support ourselves through the environment around us, especially now in terms of our home and our workspace. So virtually all of us have had to make abrupt changes in our lives, right? To adopt a new way of working and being, creating a workspace at home if you didn't already have one, managing not only your work, but also the things that are happening around you. So there are ways to bring in healing through our environment. And obviously, there's elements of place that can lead to stress and then others that can lead to calm. So on the side of the stress are things that you see in red here. So all of the things that bring out like distress, right, when they're not working in our best interest. And then the side that relates to more healing environment and the things that help us to bring in, again, that calm that we absolutely need through the course of our day. So let's talk a little bit more about those. And so when you think about calming and healing elements, especially in your place, it's sort of like we're trying to create like a built environment around us that helps support us. And bring in your senses, right? The things that you hear, the things that you smell, the things that you feel, what you see, and the things that kind of like speak to you as far as calming. So what you hear might be having relaxing music in the background. Maybe it's birds chirping outside. The best temperature, flow of temperature, ventilation if possible. Fragrances, what you smell. Maybe it's flowers around you. Maybe it's essential oils. I love the smell of fresh baked cookies. So having that in the background, let's say. What you see. So across the board, bringing in elements of nature is one of the most calming things that is available. And it's no surprise that actually during this time of shelter in place, people have been gardening more or paying attention more to plants, right? And cultivating plants or herbs. That's because this is a very calming thing for us. Or bringing in artwork, right? Your favorite artwork or images. I've been doing a lot of painting these days, so that's sort of my respite, if you will. And then of course we've talked about the importance of natural light, not only for sleep and restorative sleep, but also for during the day exposing yourself to natural light as much as possible. So whether that means around your desk or your work area, or if you have a laptop, being able to take it to a place, or just, you know, going outside and exposing yourself to light. Thank you, Kathy, for saying like plants on your desk. Yes, absolutely. Having greenery around us is really helpful. So again, from the perspective of environment is the things that you can build around yourself. How do you create an environment around yourself that helps support a healing and calming nature? All right. So we've gone through a bunch of self-care techniques, and now we're going to go into more around stress reduction strategies and tools. And I call this the 3 C's. That's my nomenclature. This is just something that I created and put together based on some major themes that are really helpful. So Kathy offered a comment. Yes, you work at 81st International. There's a lot of police activity, a lot of noise. Yeah. So having to be proactive in self-care. So whatever that might look like for you, and bringing in those elements is really important. So let's get into the 3 C's. And I wanted to start us off from this, the statement that comes from Trauma Transformed. So this is an organization that is in Oakland and focuses on trauma and trauma supportive, trauma responsive organizations. And I really like the way that they put this, which is that we're really in the midst of unprecedented times, and that it's normal to have a lot of different feelings and emotions, and that all of that is valid, absolutely valid to have feelings, emotions, feeling stress, feeling uncertainty. And this is absolutely a time to focus and practice on compassion and the collective community-based nature of helping support not only ourselves, but also prioritizing the needs of others as well. So I wanted to start there, which is the first C, which is around compassion. Now, compassion, actually, there is a lot of research out there, and there are institutes that are devoted to studies around compassion and the impact of compassion. What we know is that having compassion, having empathy, having all of the skills that are part of that activates the vagus nerve and actually helps to tolerate distress. Holding compassion also for ourselves as well as for others moves us to wanting to do something different. And globally, communities that practice compassion thrive. And we also know from a organizational perspective, management leader perspective, that when compassionate leadership exists, people, employees, are more likely to enjoy their work, show up for work. There's less burnout, there's less turnover, there's less fatigue. So having compassion on all realms is critically important and really crucial at this time. So I wanted to take a moment and talk within the concept of compassion, specifically around self-compassion, is holding boundaries, right? And so whatever this might look like for you, let's say you are managing a lot of things at home, work, family, other things that are being drawing you in, your own health, your own self-care. Maybe there's demands that are coming from work and supervisors, you know, whatever that might look like. It's so important to create these boundaries that help support you and what you need. So that might look like creating moments for yourself, asking for sheltered time, structuring your time. So you may say, you know, from the hours of 10 to 12, I'm working from 12 to 1. This is my time. I'm available to the rest of my family after 1, right? So not only structuring your time, but sharing that. Sharing your routine, sharing your structure so that other people are aware. Sharing that with your work, with your colleagues, maybe even with your supervisor. And then I want to say how important it is also to take a news break. We are inundated right now with so much, and it's the job of the news to tell us what's wrong, to sensationalize things, to provoke, in a way, a sense of emotions in people. So take a break from the news, listen to some good news. That's what the SGN here stands for. There was actually a YouTube series called Some Good News, which came out of this time of shelter in place and was just phenomenal to watch. So if you get a chance to look at that, do so. Build in laughter, build in humor, right? So important. And then do something kind for yourself. So just some examples of ways to build in boundaries, and we're going to do an exercise in just a second to explore that a little bit more for yourself. But I wanted to bring this in from a point of self-compassion. Another really important compassion tool is that of holding gratitude, right? And so again, a lot of research, evidence out there that shows that when we express and hold gratitude, it helps with all of the functionings that we need that are so important to ourselves and our systems. And so to express and, you know, even on a daily basis, name at least one thing that you might be grateful for. So I want to take you into a little activity here, and we're just going to have, you know, just a couple minutes here where we're going to put you into small groups. And Yadiel is going to help with this process. She's going to, in the chat function, put these questions up for yourself. So you'll have a link to a Google document so that when you go into your small groups, you'll be able to pull this up. Because unfortunately, this slide does not carry over when you go into your groups. You'll have probably about 4, maybe 5 people in each group. And to answer these 2 questions, so do sort of a round robin, about a minute each, a minute and a half each. One is, how do you create or maintain healthy boundaries for yourself? So maybe just naming 1 or 2 things that you do to support your own boundaries, or something that you might be thinking about, given the context of our conversation here today. And then what are you grateful for? So I love this exercise. Name 1 thing that you're grateful for, and then name 1 thing that you appreciate about yourself. So 1 thing you're grateful for can be a person or a thing. And then something that you appreciate about yourself is about that self-compassion. The goal of this exercise was really to try it out, right? So these are things that hopefully you can take away from this workshop, this training, is to think about what are the boundaries that you can help to best support yourself. And then this exercise around gratefulness is one that you can do on a daily basis. You know, just curious too, if anyone has any comments about how this felt for you. I found that naming one thing that you appreciate about yourself is often the hardest one, but yet is the most impactful one. And so this concept of not only being grateful for others and showing gratefulness and compassion for others, but also compassion for yourself is really critical and important. All right. So I'm going to move us on. And again, if you have any thoughts or comments about this, feel free to put them in the chat function so that we'd love to hear your feedback on this. I'm going to move us to the next C, which is around centering. So it's what I call centering into acceptance. And so as we noted, this is a time of unprecedented things happening. And then there are many emotions that are floating around. And all of those emotions being valid, and that this is a way to manage negative emotions, really. But the point here is, we've been talking about self-care and kind of getting a sense of yourself, is paying attention to your own internal cues and emotions, looking at how stress might be showing up in your body, and the sensations that stress is having for you. And not getting drawn into those emotions, right? Just accepting them for what they are, because what we're trying to achieve, again, is a state of balance, a state of calm, a state of rest. So this is a technique that actually comes from cognitive behavioral therapy and dialectical behavioral therapy. So it's a takeoff from those, which are basic therapy sort of techniques. And to do this exercise is to think about this in, 3 basic steps, which is, the first step is to watch and observe. So it's almost as if you're acting like you're watching yourself. You're a third person outside of yourself, paying attention to whatever you're feeling, paying attention to whatever's going on, and then starting to sink into your body and thinking about, like, what is your body actually feeling? What sensations are actually coming out? And knowing that you're not your emotions, you're just watching them. And then the next step is to label the emotion or give it an image, right? So I put an example up here, like, I'm feeling really angry and I'm feeling a tightness in my jaw because of that. I'm feeling fear. My heart is beating fast. And the image could be something like, it's like a wave in the ocean. It's ebbing and flowing. My emotions are rising and falling throughout the day. So what you're doing is, based on your observation, you're just naming the emotion and an image that it brings to mind. And then your third step is holding it. Holding it outside of yourself. You're not trying to judge it. You're not trying to do anything with it, get drawn into it. It's not good or bad. There's no judgment. And you just breathe, right? So going back to our basic breathing, grounding, stabilization. Then we move from centering into coping. So this is our third C. So what I like to call coping with a sense of resilience. So based on what we just did, which was we observed our feelings, we named our feelings, we gave it an image, and we just put it sort of outside of ourselves, we find a way to turn those feelings into a place of action, into something that works for you. And really, this is about supporting emotional expression and releasing that emotion. And if you need to, knowing when it's time to reach out for help. So here are some examples of coping stress reduction tools. So when you've gone through this centering, you can then think about different ways to help support yourself through a whole variety of techniques. They might be self-soothing techniques, right? Looking at our senses, touching, hearing, seeing, tasting, smelling. They might be distractions, taking your mind off of something for a moment. They might be doing the opposite action of what you might be feeling, right? If you're feeling sad, to do something funny or cheerful. It might be expressing your emotional awareness through journaling, writing, art. It might be bringing in mindfulness techniques, right? A lot, kind of where we started, those grounding, stabilization techniques, breathing. And then knowing that if none of these are working for you and perhaps you need extra help, having a crisis plan in place, knowing who your contacts are, who your supports are when coping skills just aren't quite there enough, reaching out to other professionals, other friends, as you need it itself. So again, take care of yourself first, and then and whatever you may need in terms of your own sense of coping. So I just wanted to review this other technique, and we don't necessarily, I would have loved to have us break into groups again, but we don't have time to do that, but we'll do it as a large group here, which is to walk you through this skill, this technique, which is the process for regulating emotions, called centering and coping. So wherever you are, whatever you're doing, if you wouldn't mind just taking a moment to sit back and sort of think about whether it's today or something in the recent past that has brought out some distress, some difficult experience that you've had in the recent past. And as you're thinking about that, notice, what are you feeling? Just noticing it, just observing it. And then as you're sinking into your body with that feeling, what are some of the sensations that are coming up? What are you feeling in your body? It might be palpitations, it might be electrical currents, it might be, noticing some part of your body, maybe you're itching, whatever it might be. So we're holding a feeling, and we're holding an emotion, and we're holding the feeling in our body. Now name it. Name the feeling, name the emotion. Maybe it's anger, maybe it's frustration, maybe it's happiness. And then bring an image to mind that relates to the feeling or the emotion that you're experiencing. Whatever image it might be. Just observe it, just watch it, just hold it with curiosity outside of yourself. No judgment, no need to do anything with it. And breathe. Take a few deep breaths as you're holding this. And now think about, for yourself, based on what you've just observed, what is something that you can do? What type of activity, what type of engagement can you do that you're willing to commit to help yourself with this feeling? Whether it's right after we end this workshop or later on today, what can you do? What can you commit to help yourself with this feeling? And I'll just pull up the slide that we saw earlier, which had all of these lovely examples of things. You might choose one of these. You might choose your own. Okay, and so I invite you to come back into the group again. And know that this is an exercise, skill set, tool set that you can do for yourself at any time and with your work with people, right? Let's say you're working with someone who is expressing some emotion, some feeling. You can walk them through this 4-step model and ask them to, commit to doing something to help themselves from a coping perspective. All right, so we've gone through a lot today, and I just wanted to summarize before we end. So we've talked about self-care first before other care, and specifically around the purpose and importance of burnout prevention. So as this image shows, you can't pour from an empty cup. Please take care of yourself first. We went through a variety of self-care skills, the 4-1-5 breathing and grounding technique, healthy sleep habits, acupressure points, tapping, how to create an environment, built environment around you that is calming and healing. We went through stress reduction strategies, the 3 C's, so compassion, boundaries, gratitude, and you have an exercise that you can do on a daily basis. Centering and coping, those were that sort of 4-step process of noticing your emotions, and doing coping techniques to help support you. And then I just wanted to bring you to kind of a way to do a daily check-in, right? I like to call this the PESS model, the PESS daily check-in, which is always to start from a place of breath, rest, and calm, which again is the thread that we weaved through all of this. But the types of self-care are in the buckets of physical, mental, emotional, social, and spiritual. I put a whole bunch of different things, including a lot of the things that we've talked about. You can add to this as well. But my sort of recommendation and what I leave you with is on a daily basis to check in with yourself. What have I done for my physical self, my mental and emotional self, my social self, and my spiritual self? So how to bring in kind of a well-rounded approach to taking care of yourself. And with that, I'm going to thank you for your time and your attention and being here. And we may have a couple minutes for questions before we close out. Questions or comments, anything that you want to share. You can either unmute or put it in the chat function.
I just want to say thank you. That was really wonderful. I really, really appreciate it. And
Thank you so
if you're going to have others similar to this one, I definitely want to participate. Are we gonna be able to see these so I kind of practice, because you took us to a lot of different exercise and I would like to re-practice again.
Yes, thank you. I think first of all, we will share the slides with you. I think that will come through Yadiel.
Yes.
And I'm open to going through these again and also other sort of techniques in the future. So we'll talk about that with the AC3 group.
Yeah,
but thank you for your comments and feedback. Yeah, advice for not feeling as productive while working from home. Yeah. So this is just, I want to validate the fact that this is a common thing. You know, we have a lot of different competing priorities all at the same time. So being kind to yourself as much as possible, right? We're not in any sense of normalcy right now. So, you know, just bringing in that self-compassion for working to the potential that you can right now, whatever that might be. It may not be as productive as you used to be, and that is okay. That's just where you're at right now. So that's sort of the best advice that I can give in just a couple seconds, which is just hold yourself with compassion with wherever you're at right now. So thank you all so much. And just in the last couple minutes, I wanted to post the upcoming trainings that are happening next week and the week after. I believe we'll be posting more, Yadiel will be posting more through the Care Connect online website. So if you've gotten an announcement for this, you're likely to get announcements for the future ones. So make sure that you're signed up. And just to thank the Alameda County Care Connect Skills Development Unit, Yadiel, for her support in the background. Thank you so much, and all of you for participating.